While our framework has served us well, we need to plan forward as our needs changes in years to come. I therefore initiated a major review of our financing framework last year. We have also held 2 sessions of Our Singapore Conversation and engaged many Singaporeans, including patients, to hear their views. Let me elaborate on 4 areas of feedback that we have received. First, Singaporeans are concerned about rising healthcare costs. Today, we spend about 4% of our GDP on healthcare, or about $1,700 per person. This is similar to what Hong Kong spends. Over time, we can expect national healthcare expenditure to continue to rise as our population ages. So what drives healthcare costs? First, cost of the same treatment goes up over time due to rising costs of manpower, supplies, and so on. This is inflation. Next, as we age and our health deteriorates, we will spend more on healthcare. On average, annual expenditure on hospitalization of the subsidy for a 65-year-old is 3 times that of a 45-year-old. The third reason, and a key one, is that healthcare is getting significantly better and more accessible. We have adopted more advanced medical treatments and technologies that achieve better outcomes for patients, and these have become more common than before. However, they are also more costly. A second concern of Singaporeans is with how much out-of-pocket cash we have to pay. Dr. Lily Neo and Dr. Lam have highlighted this. Expenses for outpatient care, including diagnostic tests such as MRI, ongoing medication, and long-term care, can become large cumulatively over time. Some Singaporeans have asked for more subsidies, especially in these areas, to further reduce their out-of-pocket bills. I will discuss our thinking in these areas later. A third area of concern arises when we hear stories of Singaporeans who incur exceptionally large healthcare bills and wonder, what if this happens to me? While such large bills may be rare in the subsidized public institutions, it is natural for us to worry about them. We need to provide Singaporeans with more assurance on this. We will carefully explore how we can provide Singaporeans with greater assurance against very large out-of-pocket payments, and we will take into consideration the various suggestions made by members. Finally, many Singaporeans have told us while there are many help schemes, they do not know how to get the help that they need. As Ms. Tan Su Shan mentioned in the budget debate, we need better outreach and communication to the public to reassure Singaporeans that help is available and that everyone will have access to good health care.